MassageTherapyPractice.com presents Doug Alexander's Masseter muscle treatment. Do not perform this treatment unless you are a regulated health professional, you've obtained informed consent to treat intraorally, and you're using a glove that your client is not sensitive or allergic to. We're going to treat Sandy's masseter muscle now. If you could open your mouth, please, Sandy. I'm just in the cheek here. Just relax your jaw. There we go. And what I do is I travel through the cheek until I run into the first muscular boundary. If I'm uncertain of the anatomy or location of the masseter, just ask Sandy to clench your teeth a bit. That's wonderful, and relax. So as she tenses her teeth, it pushes my finger back and I can feel the contour of the masseter. As she relaxes, I just follow the muscle back into its relaxed, kind of hammock-like state. So I just contact the edge of the muscle on the inside with my inside finger, and then I take my outside thumb and I roll the masseter onto my inside finger. This allows my inside finger to be maximally relaxed. At this point, I just meet the tension in the muscle with the compressive force of the outside thumb rolling the muscle onto my inside finger. And as I do this, the muscle is starting to relax. I've had one release, two releases, and there's a third. So that motor unit territory has decreased its alpha motor neuron activity, and it's softer. I often consolidate that softening by compressing the muscle slightly and dragging it both inside the mouth and outside. So I stretch it gently. You notice I'm not actually stretching the jaw, I'm stretching the muscle. You want to be careful about stretching the jaw and know that that's a stable thing to do. After I've gotten that one release, I'll travel upwards and I just work my way in a workmanlike fashion throughout the entire substance of the masseter, releasing hypertonicity and then gently stretching the muscle. Sometimes, as it softens on the outside, I'll roll down with my thumb while I maintain my contact on the inside. So I've got an S-shaped bowing of the tissue, and then I drag the tissue as a whole inferiorly towards the mandible. So the masseter needs to be completely treated right from the zygomatic arch all the way back, going slowly, releasing the tissue, all the way back to the back of the mandible and all the way down to the angle of the mandible and forward. After the masseter is thoroughly treated, then I treat the cheek muscles of expression. Notice I'm not stretching around the eye, I'm stretching all the smile muscles and all of the frowning muscles. For more knowledge, skills, and support, as well as continuing education units, travel to MassageTherapyPractice.com.